To help you take care of your horses, we present Vet Tips, featuring the veterinarians of Alamo Pintado Equine Medical Center in Los Olivos, California.
Hi, my name is Dr. Troy Herthel, and I'm an equine veterinarian and surgeon at the Alamo Pintado Equine Clinic in Los Olivos, California. Today I'm going to be talking to you about colic. Colic is the most common emergency situation that we see in our equine patients, and they can be an extremely stressful time for both you and for your beloved horse. So first and foremost, the symptoms of colic can be very diverse. It can be something as simple as a horse not wanting to eat at feeding time, to something more severe where the horse is pawing aggressively, wanting to repeatedly get up and down, or so severe that they're very difficult to keep standing while walking. Anytime that your horse is experiencing a symptom of colic, it's always best to consult with your veterinarian. Majority of colics are simply managed, and they can be managed at the farm, and whether that's just a simple dose of an anti-inflammatory, some laxative administration, and then just a good clinical examination. Approximately 80% of horses showing those signs will resolve quite well. The additional 20% of horses can definitely receive more intense medical management, and those are horses that oftentimes have to be transported to a medical facility. Fortunately, only about 1 to 3% of all colic bouts require surgical management, but when that occurs, that can be a very stressful time for you and for your horse, and so knowing a little bit about the underlying cause can be beneficial at that time. So what should you do if your horse is experiencing symptoms? First and foremost, a simple thing would be to try to check the horse's heart rate and some of his other vital parameters such as gastrointestinal sounds. In order to check your horse's heart rate, there's multiple spots where you can palpate a pulse. Two spots on the face. There's one right underneath the jaw. You can kind of palpate for the vessels right through here, and then just lightly depress and you can feel the pulse. Typically, we'll do this for about 15 seconds and then multiply the number that you have by 4. The average heart rate for a resting horse is about 36 beats per minute. So if it is elevated in the 50 to 60 degree range and the horse is not overtly showing signs of stress, then that is a concern for more of a serious underlying condition. Another location where you can palpate a pulse is on this little transverse facial artery, which is right below the eye and right along the lines with the facial crest. And so lightly depress there and you can feel the pulse beating there. If you happen to have a stethoscope, this can be done by listening to your horse's heart right behind the elbow on the left side. And you can place the stethoscope right up behind the triceps muscle to listen to the horse's heartbeat. Once again, the average heartbeat for a full-size adult horse is about 36 beats per minute. If the horse's heart rate is elevated, 50 to 60 degree range, then there's some more concerns that there's some significant either pain, dehydration, or some other cause of distress in your horse. Gastrointestinal sounds can be listened on kind of all 4 quadrants of your horse's abdomen, both on the left and right side. So normally you'll hear somewhat of a rumbling sound as the horse's gastrointestinal tract contracts. If you do not hear any sounds at all, then that is definitely much more concerning. When listening to the horse's abdomen on the lower part, especially on the right-hand side, this is a common spot where we'll hear sand within the abdomen, which almost sounds like waves crashing on the beach. The next you want to check a capillary refill time, and so you can lightly depress over the membranes and then watch to see how much time it takes for the blood to return. Anything under 2 seconds is within normal. If it's prolonged, then there's a sign of possible dehydration or more serious illness. If the horse's membranes are very tacky and pale, then definitely that's concerning and your veterinarian should be consulted. So checking for skin turgor is a way that we can determine if your horse is dehydrated by lightly pinching over the eyelid and watching to see how long it takes for the tissues to go back can determine if your horse is dehydrated. If they're overtly dehydrated, that will be prolonged. It'll take more than 2 seconds. You can also pinch over the neck to check for skin turgor. However, this can be a little bit more unreliable. Checking the horse's rectal temperature is also another good step as far as checking vital parameters. I recommend grabbing a hold of the tail and standing off to the horse's side, whether it's the left or right side, away from the hind legs, and then gently inserting the thermometer, oftentimes with a little bit of a lubricant. Digital thermometers work very well and have a short amount of time. And once again, anything over 101 is considered abnormal. 102.5 is where a significant fever occurs. There's numerous things that you can do to try to prevent colic in your horses. First and foremost, always providing them with good quality feed on a regimented schedule, providing access to fresh, clean water, especially in times of weather change or extreme heat. Limiting excessive carbohydrate intake with simple sugars from grains is also beneficial. In the times of stress with your horse either hauling or showing, the addition of different gastroprotectants, whether pharmaceutical or probiotics and prebiotics, can be beneficial in preventing colic in your horses. Other things such as routine wellness exams with your veterinarian, as well as proper parasite management protocols can also be beneficial. So if you have any concerns at all with your horse displaying any of these symptoms, it's always best to call your veterinarian, as early intervention typically always improves your prognosis. Once again, my name is Dr. Troy Herthel with Alamo Pintado Equine Clinic, and hopefully this will help you out with the future health of your horse.